this last week, but there's a soft spot in the baby's head. This is plastic, but there's a soft spot in the baby's skull where the membrane has not yet ossified. Remember, it's membranous ossification within the membrane. This is a real baby skull. And yes, it's very fragile. It is real bone as opposed to the plastic. It's apparently a baby that died. It wouldn't be an abortion, usually. It would be right around birth.
Just like everybody.
So, anyway, this demonstrates we had endochondral ossification and intramembranous ossification. And the flat bones of the head were intramembranous. Pass that around to every one of them, tell them to handle it fragilely, and pass it back around to this group so you see how beautiful and fragile it is.
So what's ossification?
Ossification of intervertebral
Membranous. Within the membrane. And the membrane hasn't calcified on top. And that's where you do not put your thumbs in a newborn, because you can press through and damage its brain. Okay?
Right there.
All right.
Kill a baby.
Oh, somebody kindly left me their pen.
You want to record it next.
All right. The first thing we need to do is we need to learn the structure of a vertebrae. Now, those are colored with some marks on them, and I think that'll be fine. Kendra, if you can share your notebook a little further over here, right there is good, and we'll use the notebook. We're on page 134. The vertebrae have a body or centrum, and if I turn this fellow around, you can see the body or centrum is anterior, and you can see it on this one. Here's the body or centrum. There is an intervertebral disc between each of the vertebrae, and so we've got centrum, and then we also want to know there's a vertebral foramen. Here, have one. You probably need it, several of them. All right, this is the vertebral foramen. When the spinal cord leaves the brain, it goes cortex, midbrain, hindbrain, brainstem, then it goes in the next spinal cord. It leaves the brain by the foramen magnum, and where does it go? Down these holes, which are aligned one over another, so it forms the vertebral canal, and that's where your spinal cord goes. Now, the next thing I want to know is the processes. So if the centrum is forward, the process in the back is the spinous process. Okay, this is the spinous process, the one that sticks out posteriorly, right there. Pass it, give them a handful and pass it around. Okay, a couple typicals. We just need a couple typicals. So this is the spinous process. Now, when I look at this, if I've got the spinous process, which is posterior, then I've also got the two little ones sticking out like arms. So these are the transverse processes. These things are different. They are articular surfaces. We haven't gotten to those yet. So right now you have a spinous process and a transverse process. Spinous and transverse. You have a lab book over here, it'll really help. If anybody has a lab book over here. One lab book right here would be great.
Somebody without a lab.
Okay. We're on page 134.
Picture like this.
Absolutely. Are you going to lay it there? We're going to come all the way around. Okay? All right. Now, then, as I look at this thing, I'm going to draw an arch. So here's the body of the centrum. Here are the transverse processes. processes, and here's the spinous process. And now there is an arch. So the feet that hold up the transverse processes are called the pedicles. You see the pedicle? And it's on here, right here. These are the pedicles. Point it around, hand it to them.
Okay, that little,
They're
the
the,
little groove.
they're the feet that the transverse
Right
processes
there,
rest
right
on.
here.
They're like a pedestal.
Okay.
Okay, holding up the transverse processes. So then, from the transverse process out to the spinous process are the lamina. And you see the lamina. The lamina fuse to form the spinous process. So pedicle, lamina, fusing to form the spinous process. Okay, pedicle, lamina.
Pedicle again.
Pedicle, lamina, fuses to form the spinous process.
Pedicle.
And if somebody's really hurting with a pinched nerve, they may cut that lamina. And that is a laminectomy, and it will relieve pressure on the nerve. Okay? All right, now, I want to pass them around, make sure everybody handles them. Okay? All right, now then, I want to show you that if I stack two vertebrae up, you're going to have a new opening. So I'm going to stack them up like that, and what do I have? I have an inter, that means between, intervertebral foramen. See? And that's there before.
And this is it right here, right?
Yes, it's where the spinal nerves come out. There's another knot besides this one. Here it is, it's right in front of me. All right, that intervertebral foramen is where the spinal nerves leave the spinal cord. And so these here, not these, but this, are the spinal nerves. They aren't yellow spaghetti. I had a green model once. Somebody told me they were green spaghetti. They're spinal nerves. They come out between every segment of your vertebral column. So you'll pass that around. Take a deep breath. All right, now when we put these things together, the way you put them together is there's a superior articulating facet and an inferior articulating facet. That's what I'm talking about. So the superior goes over the inferior, and otherwise there, and they fit together like that. Okay, superior is going over inferior. See how they go? So pass that one.
Superior what?
Are you sure?
Articulating
Process.
facet.
Back.
Facet.
Okay, right here.
Okay? So if it's on top, it's on the bottom of the hair, but it's on top, and it's going to go over the under one at the top there. And we can do it again.
Yes.
Okay, so this one's on top, but it's the bottom of this pig. So this one comes in, this one's on the bottom, so that's the inferior articulating facet. And see how they fit? Neat.
Sweet.
Pretty neat. The whole thing is neat. All right. Now then, the next problem is, remember 7, 12, and 5. How many cervical vertebrae do you have? 7. How many thoracic? 12.
Nice.
How many lumbar? 5. Great. Now how many, if I lay them out, if I lay 3 of them out on the table, and I say which is which, how are you going to know?
I'm about to calm down.
Well,
Learn.
Learning cervical, thoracic, and vertebral.
There are more around here somewhere. If you could pass the vertebrae back to me. thoracic joint, these big chunky ones I was saying. That was, okay. Yes, that's wonderful. All right, I'm gonna lay three of them out like that, and I'm gonna say which is which. I don't know. All right, how are you gonna know? This is a cervical vertebrae. You see the transverse processes? You see the hole in the transverse processes? All right. Where's that model? I need that model. That one, that's great. Okay, we have a dual blood supply to the brain. The carotid arteries go up the front of your neck to the brain, but in the back, the vertebral arteries go up the back of your neck to your brain. Here are the vertebral arteries. Where do they run? In the transverse foramen of the cervical vertebrae. See that? All right, so if you pick up a vertebrae and it has a hole in the transverse process, immediately it's cervical. Okay?
Okay.
The other little thing about the cervical vertebrae is they are split in the back. And none of these were very good, but they'll do. This one's good. Those models aren't bad. You say it is bifid. The spinous process is split in the back. Bifid, B-I-F-E-D. And what is that useful for? If, when I try to extend my neck, it isn't split, it wouldn't go. But if it's split, the spinous process of the one above it fits in it, and it allows you to extend your neck. Okay? All right. So here, you can get them out of that side. I think they're mostly on that side. So here, pass these around, if you wish. Okay, another one, Kendra.
So,
Okay. Okay, just not
so
a good
these two
example.
holes right here?
Yeah.
There's two.
Here, and here.
Okay, on the side.
Here.
And that means they're the
Cervical.
cervical. Cervical.
Transverse
Two
foramen.
holes, no matter what.
Transverse
Anybody else want it?
Okay?
There's transverse foramen in the transverse. Is this the cervical? Yeah.
I'm just trying to do German.
This is the vertical, right?
All right, now how am I going to know a thoracic vertebrae? All the thoracic vertebrae have really long spinous processes, and they all point downward like this. Okay? So here is a thoracic vertebrae. This one's pretty good, not bad. It does not have the transverse foramen. Here's another one.
It points down. And the
Yes.
spinous processes points
Yeah,
down.
well,
It's
no,
the
that's
thoracic
probably, that's a
vertebrae.
good
It
one.
looks like an elephant nose.
No.
A giraffe. A giraffe, yeah.
That's fabulous.
Oh my God,
What's
it's like
the
a
name,
giraffe.
Sticky?
This is thoracic.
Okay?
Thoracic.
Anybody like one?
Della, get in and fight for your position.
This is the thoracic.
Yeah, that's not perfect. Hers is better, because it's downward. See how it comes downward?
I'd like to see somebody try to break in here.
All right.
Let's see what
Now
damage
let's
they
use
can
some
do out there.
thoracic, some lumbar vertebrae.
They're big.
Yes, they are. They're on the front of our body, and they're huge. Oh, I have three photos of her. We have some dust. All right, how am I going to recognize a lumbar vertebrae? One, and this is how I know it. One, it's big and chunky. But two, the spinous process looks rectangular, and it would have four sides. So it's quadrilinear. One, I can measure it. Two, three, then I have to play postage stamp and go dot, 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 and there is four. It is big, chunky, and quadrilinear. The spinous process.
Looks like a moose.
Okay? All right, anybody back there need one?
What did you say that was called?
This is the lumbar vertebrae. It's a it's the spinous process, and it has four sides. So four quadrilinear. 1, 2, 3, and you imagine 4 to complete the rectangle. All right, now. The next one is to go back to C1 and C2. Let's put, are you getting something out of this? You want to fight your way in here and take more active participation? I would take that little bit of skull and get it out of the way. But I'd take that one because it's, all right, thank you. Here you go.
This one?
And I'm going to use this one. Okay.
Not foramen,
Fontanelles.
Fontanelle, yeah, Fontanelle. I said foramen, and I've been on.
It's on the list. If you learn your list, it's on there. Now remember we have the occipital condyles on the occipital bone. And now we're going to look at C1, the axis. The book tells you on page 135, it says the axis has no body. You can read it to me. The axis has no body. It does have the transverse foramen, but it has these, they're kind of mini fossa. They are little shallow spots, and the occipital condyles are going to fit onto there, and then you can wrap your head, yes. Okay, so that's C1. There were a few C1s that were disarticulated, but I don't think there are very many. It has no body, and it has no spinous process. What about, and it's an atlas, he held the world on his shoulders.
This one right here.
Yes. All right, now C2 is called axis, and I relate that to the old TV shows, As the World Turns, my mother watched. You see the little head sticking up here? This is called the Dees or odontoid process. You can pass that way. I'll pass this way. It's a pair. Josh or David? Josh, no, Phoebe?
I answered either one.
No, help it. David,
David.
Laura, Josh,
That's it.
Phoebe. Okay, fine.
Thank you.
All right. Now, this is the Dees or odontoid process. The thing looks like a turtle. You cannot miss it. And it is C2. See the head? It's like a turtle, doesn't it? Okay. Now what does it do? It sticks up through here. There is a ligament that holds it in place. And then when the head fits on there, now it's a pivot point. And you can say no. Okay? C1 and C2. The atlas and the axis. Are we okay with that? Then we're done with vertebrae. Now, I want to do sacrum. The next thing is sacrum. And we had a batch of them out, but I think I put them back. Here is 1, 2. I get this one for a special reason. 3. See if you can scrounge some more out of that box or laying around. Anybody have a sacrum? Okay.
Isn't it like whenever you're a child, you have 5 bones of the
Yes,
sacrum?
you do.
And then it's fused together to be one?
Yes. In an adult, the sacrum is 1 bone. In a child, it's 5 bones. They fuse, I don't know what year it's completed at. And then down at the bottom is the little coccyx. How many vertebrae are in it? Four. They fuse too. And there's one coccyx in an adult. So there's
So
20.
all together is 32?
33.
33.
But look, in an adult, it's 24 plus 1 plus 1, 26. In a child, it's 24 plus 5 plus 4,
So
or
33.
33.
And a
And
child.
that's then,
All right,
So an adult is
so an adult is 24.
An adult
okay.
is 24.
plus 1 sacrum and 1 coccyx.
So
So
26.
26.
So an adult's 26.
Depends on how the question is worded.
Oh, yeah, she picked up what we were putting down. Oh, no, she didn't. She went there. Oh.
Shade. Shade.
It's okay, she went along with it, it was great.
Okay, yeah.
Thank you,
So-
by the way.
So after you come down through your lumbar vertebrae, then the next thing is the sacral. So it would have been S1, S2, S3, S4, and S5, but now they're fused. So we look at the sacrum, and this one is a real human sacrum. Those are plastic. But I got this one out because, one, the vertebral canal is still open. And I can show that it goes all the way through. So I can show that at the bottom, these processes have not fused yet. And therefore it is open, and that is called the sacral hiatus. A hiatus is a break. You have just been on the fall hiatus or fall break. This is where they give spinal anesthesia. They come in through the back and give a needle right in here, and the anesthetic will diffuse around the spinal cord and anesthetize your lower body. This is, as far as I know, people are calling this an epidural. I don't think this is an epidural. But this
I
is
don't know when I got my epidural.
This
Yeah.
is spinal
That's right there.
anesthesia, and it could be given in childbirth.
Yeah, they
to-
make you do an arch,
Yeah.
and you have to be real still, and they
Yeah.
go right in there. It
All right.
hurts like hell. It still hurts. That's
So let's see
17 years
what
old.
else we find on it. Now, Ashley, isn't that great? You side to side. Right. Come in here, fight for your position. You too, Della. And so here we go. This is the sacral canal. It's a continuation of the vertebral canal. These, anteriorly, these are the sacral ala, or wings. If you turn a page, you'll see there, all the diagrams, and you see the sacral ala, or wings, here, okay? And then we go to the back, where the spinous process is fused. That's the median sacral crest. There are two lateral sacral crests. There are also sacral foramen, and if you're poking at it from the front, it's anterior sacral foramen. If you're poking at it from the back, it's a posterior sacral foramen. It took me forever to figure out why when it's the same hole. But the spinal nerves split, and there's an anterior ramus and a posterior ramus, and that's why. Now, we mentioned the sacral hiatus, where the processes did not fuse. These are called the sacral cornula. And then, this I want you to know. Put your finger here on the body, on the front, and this thing is contracts forward. You put your finger here. This is the sacral promontory. Now, I'll take, I need a pelvis that is, there are lots of them. Now I need a whole pelvis. This whole thing? That one. Yeah, it'll do. All right. A little more than do. But I'll take the other one, actually. That one? Back there against the box? This is it. Exactly.
Too close.
All right. Now that sacral promontory, as far as I know, the radiologists measure on the X-ray from the lip here of the sacral promontory across to the pubic symphysis. And that's one aspect of the pelvic brim. And then this way is the other aspect of the pelvic brim. And then that's supposed to tell you whether the pelvis is big enough that the baby can grow and come through. So it's used in what they call pelvimetry, which is measuring the diameter of the pelvis. Anything below this line that goes across the pelvic brim is true pelvis, and anything from that line, the pelvic brim up to the hip bones, the iliac crest, is false pelvis. True pelvis, false pelvis.
Can you turn around?
True pelvis below the pelvic brim, false pelvis above the pelvic brim, the top of the hip bone. All right, there's only one other thing I think I need, and that is the sacral, the auricular surface. See on the side it looks like an ear or auricle, and this is the surface that is going to fit with the hip bone and form the sacroiliac joint, the auricular surface. And I'll let it go at that. That's good enough on this thing, we're fine. Now, here's your little coccyx. This class is so well paid compared to the other class, it's unbelievable. They were asking
Since she said
questions
coccyx.
all over the
We should get 10
place.
points at the end of
They were kidding around.
I know, 10 points.
I'm saying like an extra 2 points on the test or something.
Yeah,
and
you
they
can
would
get
be
points for
great.
behavior.
Excuse me, the people that made 90s can use 10, but the other ones can use 10. I mean, 2.
I want somebody
I was like, I'll take the 10 still.
somebody get out their smartphone and put in baby with tail.
I got that.
All right, now sometimes in development, the coccyx, which in us is vestigial and we don't need, actually we do. It's an anchor point for some of the membranes of the vertebral column, but it's more or less vestigial. Sometimes it doesn't stop growing. In us, it's 4 vertebrae long, but sometimes it doesn't stop developmentally. And babies are born with tails. I do not know the statistics. 1 in 10,000, something of the sort, every now and then. In a developed country like the United States, they would cut it off. I'm not even sure the obstetrician would tell the mother. He might just go snip and she'd never know.
What kind of tissue is it made of?
We are monkeys.
It is.
We are
Does it leave
monkeys.
a scar
And skin over it.
when
No muscle
So does that leave
Maybe
two?
a little, but I doubt it. Their tail, I think, could probably wiggle like a dog's tail.
Does it grow out of, like, where does it grow?
We are monkeys.
Where does it grow out of? Like, is it your back?
I guess
Like right
it's
above
turned
the
Right
this
back?
way
And the
instead
real
of that
bone.
way. It turns that
So
way.
that would be if you had 2 coccyx in an x-ray and it shows 2 coccyx.
It would not show two coccyx. It would be an extension of this.
What would it be if you have an x-ray where there's a
This
coccyx
is a
like
real bone.
laying on
I don't know
top?
how somebody breaks
I've never
this.
heard of it. Have you seen one?
That's some,
I have one.
You do?
oh, I can do that.
Neat.
You know,
Does it hurt?
Well, I have back pain all the time, but that's what the doctor said. I had like I was fused with a twin,
Yeah.
and just like 2.
All sorts of things happen.
No.
Oh my gosh.
It was like that.
When they cut the tail off,
And have a tail.
okay.
All right.
Twin.
Now, in foreign
Oh my
countries,
God, that'd be
underdeveloped countries, if a baby would be born with the tail, they probably wouldn't cut it off. And in some countries, that baby would be treated as a god and being very special. And so, it depends on.
So what? So has somebody like grown old with this thing? Like what happens to it if they keep it? So they have a tail.
He gets lots of gifts because he's worshipped.
Tail, doesn't he?
No, I cut it off.
He's
My
special.
bulldog gets a tail cut.
I'm
Am I right? Am I
Like,
right?
at your feet, you wouldn't use it.
Yeah, I mean, I don't want, it's a shame when they wrap it up under their butt. You know they're scared at that point. I don't want a scared dog. Cut that tail right off.
Alright.
I'm just joking.
So, everybody's seen a
Probably
coccyx?
not.
I mean, a sacrum, and you've seen the coccyx, and you know the story about baby with the tail. Beep, 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 beep.
It's so cool. I can't get over this.
I had no idea that was even possible.
Knock somebody
Alright,
out.
there's badger ribs in here. Ribs to our hearts and cattle. And then, two.
Here, I'll have you some ribs. Yes.
All right, now the next thing I'm looking for are clavicles. And they're C-L-S-shaped. I've got 'em.
No, it's scapula.
No, you're totally fine.
Clean up this mess a little bit. Anybody with vertebrae, we'll put them back. Clean up the mess a little bit. Okay, I'm trying to put cervical in there, but it's not absolute. The black girls will sort them out.
Oh.
Okay, it's okay. Don't worry about it. I'll sort them out. Thank you. All right, now that makes us a tad neat. Now, where are some of these ribs? I need a rib or two. A rib or two? A rib or two. Thank you.
They're awful bland, are you sure? Nothing on.
All right. Now, as we look at this guy, you see, ribs are C-shaped, but clavicles are S-shaped. You want to remember that, because if I put them both at the table and I say which is which, a rib is C-shaped, a clavicle is S-shaped. Now, we pick up this rib, and it's curved, and it's got a head on it. Do you have a rib out there? We need some ribs. We need some more ribs? Ribs. Make sure they all have some. Now, when you're through, they go back in there. All right. We pick it up and we go head, neck, tubercle, head, pinch, neck, bump, tubercle. So easy. Head, neck, tubercle. Can you all do that?
We broke a rib.
Oh no.
Is tubicle that little thing?
Yes, it is, absolutely. Now you see it curves, and there's there's a ridge under it where the nerve artery and vein run, but you don't need to know that. So, the head, the neck, the tubercle is where it attaches to the spinal column. And this blunt place in the front is where the costal cartilages will go.
She has a book.
So these are the costal cartilages.
It attaches to the scapula, right?
No, it attaches to the spinal column. Okay, so, you see, this is all hyaline cartilage. This brown stuff is really plastic, but at least they had the decency to make it a different color. So you can see these are the hyaline cartilages. And they would be arising right here from this blunt end of the rib, and then they would attach either to the sternum or to the cartilage above, which is the next thing to discuss. All right, so we look at the handout. It says we have 12 pairs of ribs. 7 of them are true ribs. They go from spinal column to the cartilages which attach directly to the sternum. 5 of them are false ribs, and 3 are vertebrochondral. Instead of the cartilage going directly to the sternum, cartilage goes to the rib above, the cartilage of the rib above.
Those are the ones that break.
Instead of vertebrosternal, they're vertebrochondral. And there's 3 pairs of those. And then there are 2 pairs of floating ribs that do not attach in the front. And so they are just vertebral. And that's on there. So we've taken care of that. This is head, neck, tubercle, shaft, and this is sort of the angle. We can put the ribs down.
Is a certain rib more common to break? When someone breaks a rib, it's all over.
You have to ask a physician. Okay, I know things about it. All right.
I bet she could do a surgery and not miss a beat.
Now then, the next thing we want is the sternum. And there are usually models around that are loose, but are uncommon. So let's just look at this thing here. Here you have the manubrium. By rights, you should put you get away with putting the manubrium, period. But when you go to body, you have to put body of sternum. And then you have the xiphoid process, this little thing down here. So there are 3 parts to the sternum: manubrium, body of the sternum, xiphoid process. The problem with the xiphoid process is that when you're doing CPR, if you position your hands in the wrong place, you can break it off. It's very fragile and you can break it off. You know someone it happened to?
I thought it was supposed to happen.
Okay?
No.
And if you do that,
Broken ribs,
if you do
do
that,
not resuscitate.
it's very tough on you. It's very
Tough on the
hard.
family.
It's excruciating. But anyway,
Do it right, you
If-
get good for you.
if I get in that state, I want to be resuscitated. I want
Yeah.
to live to the last possible moment. If you break off the xiphoid process, you can drive it into the liver, which is very vascular, and you can drive it into the spleen, which is very vascular. And both of those would cause hemorrhage, and the person could bleed to death if you were out in the field.
Is there anything that's supposed to crack? I swear I heard somewhere that something's supposed to crack whenever you do the CPR.
There's like, some people will say sometimes good CPR will cause broken wrists. I've heard people do that.
Yeah, like that's I learned. My teacher in high school when I had an
It's a
anatomy
chaotic
said,
But it's not the
situation, you're
xiphoid
trying to
process.
save the
It's not the
person, you're
xiphoid
on them,
process.
and it's hard. You have to have your arms a
Yeah,
certain way.
they
and
said if you don't, you're not doing it the
you're
right
on
way.
the wrong
Yeah.
area, it would break.
You're putting
in a
so much pressure.
In a second, it would
It's
break.
not the xiphoid.
And you have, most times they have student doctors that come up and to
Don't know
practice.
anything.
So you're
Don't know nothing, they get in there,
Yeah,
get
that's why they
hyped,
did the little
get
finger
crazy,
test
and
thing.
it's like,
You go up
I just
higher.
want, do I got a good perfusion on the cold? I got a good perfusion. You're like, you
2
killing
inches,
that
2
lady.
inches.
Killing her.
There is nothing like first-hand experience.
Good Samaritan law.
All right,
Yep. Good Samaritan. Oh, good Samaritan.
all right. So,
Hello.
before we leave, I think we're okay here. I do want to back up a moment. I want to show you this model, which is really rather neat. And it's a model of a slip disc. And I want to tell you that you need to be reading that book and the lab book. The intervertebral discs, the discs between the vertebrae, are structured like this. They have a soft part in the middle, and the soft part is pulpy, is soft. So it's the nucleus pulposa. Sound it out. It's soft. Then it has a ring of fibrous connective tissue around it, and a ring is an annulus. So this is the annulus fibrosa. Now normally that remains intact and it prevents you from hurting every time you take a step. But sometimes this annulus pulposa annulus fibrosa gets weak, and so it sort of breaks, and then the stuff in the middle can squeeze out, and that's called a hernia. I want to point that out to you again. And so when it herniates out, it can press against the spinal nerve, and that hurts badly. That's what's known as a slip disc, and you might say that was a slip disc between L1 and L2, or L2 and L3, or T1 and L1, T12 and L1. But this is a wonderful model of a slip disc. Okay? Now we go on our list. Okay. I've done bones of the thorax. Turn it over. I've done bones of the vertebral column. Turn it over. Now we get to bones of the upper extremity. We're going to the appendicular skeleton. Huh?
Oh, I got excited.
And so, the appendicular skeleton is made up of the pectoral girdle and the arms. Pectoral, because that's where your pectoral muscles are. That's the pectoralis major over on there on that man. He's fallen apart since last hour. But anyway, this is your pectoral girdle. Now, there are truly fascinating things here. And I've got to go get some more stuff out, which I will do after I clear this table with the pen. But there are two bones on each side, and this is how you rate it again. If I say how many bones on each side, it's 2 bones in your pectoral girdle. And they are the clavicle and the scapula. Total, there's 4 bones, because there's 2 on this side and 2 on that side. But the answer would be there are 2 bones, and that's your pectoral girdle.
Clavicle, one for the scapula. I think I need 2. Bone. So we're not, no, I got this one. I get some more. 2. Yeah. There's only 204 more in the body. 2 bones.
Alright, so, checking out the middle. Is this a him or a her?
It is a her.
Okay, and is this a him or a her?
It is also a her.
No, it's a him.
Oh, it's too far up under. So there's no babies coming out of that
Here,
thing.
no, see how narrow it is?
Never mind.
You can't get a
Yes,
baby
this
through
one's
that
much
hole.
wider. No, you can't. You see this pad of fibrocartilage? It softens at the time of childbirth. It wouldn't move completely apart, but it becomes slightly more flexible.
So does the man, does this like thing come further up in here?
It may, it
Than a
tells you in
woman?
the textbook, all about it.
Oh,
You can
okay.
compare in the textbook. The
Yeah.
one I know is the angle here. This is more acute, and that's more obtuse. This one is a sharp angle, and this is a wider angle. And the bowl here is wider, the bowl here is less. Okay? And that's how I would measure it. But I'm no expert. I wanted to be, but I'm
You're more of
not.
an expert than me. I'll take it.
All right, if you find any more of these things, this is what I'm going to do next. This can go back in the box over there, if you will. Okay? All right. So the 2 bones of the pectoral girdle are the clavicle and the scapula. The clavicle is S-shaped compared to a rib. Couple back here, 2 or 3 back here. I'll keep on. All right, so you want to pick it up, and you want to notice it has a blunt end and a flat end. And in addition, it is convex forward, and we want the flat side on top, not the rough side. so the flat side goes on top. That's the way it would go. This is the blunt end. This is the, well, now let's see. That's the blunt end. This is the flat end. It got glue on it. From where it was in one of these things. All right, so here's what I know now. The blunt end is the end that goes against the sternum. And so it's going to fit right here against the sternum, okay, against the manubrium. And they say that it is curved anteriorly or convexly anteriorly, so that if you fall, you aren't going to, and it breaks because people break their collarbone. This is the collarbone, the clavicle. It wouldn't lacerate your subclavian artery and cause you to bleed to death.
Well, that's
No.
good.
Lacerate?
No, it wouldn't cause you to lacerate your
No, would not. You break forward away from it.
Right.
All right, now, what do we call these things? Well, this is the sternal end, that's okay, but what do we call this? It is the acromial end, because it's going to lay across the acromion. Now, I do not have this many scapulars, but I've got one, it's plastic, another one, it's plastic, put it back there to that crowd. Another one, this is real, it's crushed, not that crushed, but it's not as old as these. And these are real, okay? All right, the first thing you learn is when you pick up a human scapula, they are incredibly fragile. I do not understand how we can manage to live and not break our shoulder blades. But we don't. And the reason is we're thoroughly padded with muscle. Okay, so you really don't often, I've never heard of a broken shoulder.
That's a real one.
But let's pick one up now, all of us, or groups of us. This guy knows, look over there with Wes. And your name again? Carlin. Collins, okay. You look over there with those two. Now, I only, there's probably 15 kids I still don't know. So tell me all.
You're
Okay.
one of them.
I know you.
I would-
You're free. You're Brandon? No, you're Freeze? Who are you? Zachary? You're John. Well,
Joseph.
Brandon.
I'm just kidding, I'm
you're
Brandon.
Brandon.
Yeah. You got, you, Finley, so you kind of freeze.
I know
Brandon
him,
freeze.
I know him, I know those two. I know him. I know most of the girls, but not all of the girls. You are?
Victoria, Tori, I go by Tori, but Victoria Adams.
Adams, first on the list.
Yes.
And
She doesn't know which one's which.
Mary.
Is that why?
Okay, and, Mason, okay, Della I know, Miranda I know, Kenyatta, how could I help it, no Kenyatta? I know Kenyatta, I know, Miss Clark here, Lindsay, Ashley, Ash and Ash, here, these two.
Forget this by
And
next
I know
semester.
three, but not all of them. So let's get going, let's learn this better. There are several things when I pick it up that I'm going to see. The most prominent thing is the spine. Can you follow the spine out to the end? And the spine is on the posterior side. All right, at the end of the spine is the acromial process. Here is the acromial process. At the end of the spine. And that's going to be the point of your shoulder. And with our clavicle here, the flat end of the clavicle is going to lay across the acromial process. But I've got to get properly a right and a left, I probably can't. At any rate, we've now identified the spine of the scapula and the acromial process. What's this? Coronoid.
Coronoid process.
Coracoid. Chloroid, yes, it's chloroid process. Chloroid. Because that stupid rhyme that I made up, chloronoid, chloroid. We'll make chloronoid again.
Noid,
Chloronoid.
and then noid.
Here.
No, on the bottom.
Okay. All right, so we got these two. Now, let's look at the shallow fossa out here. This is the glenoid cavity or glenoid fossa. The head of the humerus is going to fit in that. So this is your arm socket. And because it is so shallow, you're going to have tremendous movement there, as you will know if you read the chapter on articulation. And that's what enables the pitchers to wind up and be able to throw those fantastic pitches.
That's your right.
All right, so now, if I had to make a choice as to whether this is right or left scapula, here is how I do it. I find the glenoid fossa. I know the thing is, I know the spine is on the back side of it, and it's concave anteriorly. So the only way it can possibly go is like that, because the glenoid fossa has to stick out. Otherwise, my arm would be growing out of the middle of my back.
So just remember the spine is the posterior.
Yes.
It's big.
But see, it cannot go,
Like that, cause
it can't go this way because my arm would be growing out of the middle of my back. And that does happen. I mean, things like that happen. Incredible things happen in development, which you hope don't happen. But I know now that this is a left scapula. Okay? What else do I know? If this is the glenoid fossa and it's out here, this would be in my armpit area, and this would be the axillary border. If this is the axillary border, this is the vertebral border. Now there are three fossa you want to know because we're going to name muscles next week. All right, find the spine. You lay your hand in the hollow above the spine, and you say supraspinous fossa. Above the spine. It's a hollow, so it's a fossa. The supraspinous fossa. Below the spine is the infraspinous fossa, and on the front is the subscapular fossa. Check. Pass it, make sure Ashley and Ash see it and handle it. And Miss Madden also, there it is. All right, now why is that important? Because we have a list of muscles that are worse than the list of bones. And so you'll have the supraspinatus, and then you'll have the infraspinatus, and then the subscapularis, and then the teres minor, not major, and they make up your four rotator cuff muscles. Okay? I'd have to look it up. This is the inferior angle, the post-superior angle, and the scapular notch. What are the names of the notch?
It's called the suprascapular.
Suprascapular notch. All right, so we've got that done. Now let's go to arm bones. The arm bones were in this box primarily and beneath, and the leg bones are over there. So I'm going to fish out as many arm bones as I can.
My brain's shot. I'm going to do more today.
What'd you find? Okay, I need about 6 of those. I think there was 6 in there. Okay. Well, you all need to keep one out here. You need to include the people behind you. You start your way in there. Nope, not that one. Not like that one. Bring them back that one. all around the table, and you have two bones with a head on it, it becomes obvious this is the arm bone, this is the leg bone. It's much longer, it's much heavier. All right, so we're going to pick the thing up. We're going down the list. We're going to say head. Then you're going to squeeze it right around here. Neck. Then you're going to go down on the shaft, right below the head. And you're going to say surgical neck. It goes head, anatomic neck, surgical neck. Head, anatomic neck, surgical neck. Because the surgical neck is where you break it. Let me show you. Head,
I don't wanna break it.
neck, surgical neck. Head, neck,
So
surgical
they never
neck.
break it at the head?
Huh?
They never break it, they only break it at the neck?
I don't know about only is powerful. Only is
You're fine.
okay? All right. All right, now here we go with some more tricks. Look, these are tricks. Okay. One, it's got two bumps up here on it. One is higher, one is lower. One is the greater tubercle, one is the lesser tubercle. There is a groove between the tubercles. The groove is simply the intertubular groove between the tubercles. Okay? So we're just coming down the list.
So that is this, what you're just saying, that's the interior view, what you,
I'd really like to have a book there, but yes.
oh, I got it out the book,
Yes.
I had to draw it.
Yes, I know. It really does. It really does. You have to go to the next chapter, which is chapter 10. All right, so we back up one. Okay, so here's the groove. Greater tubercle, lesser tubercle, intertubercular groove. Or sulcus, we're calling it sulcus, which is perfectly fair. All right, halfway down the shaft, or maybe a third of the way down the shaft, is an opening, and that is the deltoid tuberosity. Dallas, since I'm hemmed in over here, would you get up and go over to the man and put your hand on his deltoid muscle? Look over here, and yeah, perfect. And see on this side it's intact? Yes, that is the deltoid muscle. That is where the tendon from the deltoid muscle inserts on this roughness the deltoid tuberosity. And I always tell you kids, be thankful for something simple. Something I can ask you, like what is the significance of the deltoid tuberosity? Oh gee, it's where the deltoid muscle inserts. So look for the simple things. Okay? I don't promise I answer.
Remember what?
All right, now we're going to look at the bottom of the face. Don't look at the back where there's a fossa, look at the front. And the front is complicated. So you go down to the bottom and you find a pointy process. Okay, find the pointy process. Do we have any more of these things around? No. Was there an articulated one over there? No, that's not. That's the right one. No, gotta have a head on it.
Let me see. Is it one of these? No.
What do you suppose in about 2 minutes? It's okay. Josh, shut up. Make sure that you point to that. It's not Josh, it's David.
It's okay.
Hey, John.
Hey Josh, how you doing, man? Joshy.
All right, now look, behave, everybody behave. Hold it like this. Hold it and run your hand down to the bottom. You've got to let go.
I know.
All right. Find the pointy thing. The pointy thing is the trochlea. Put your finger on the trochlea. Okay? Now, what did I tell you about Tiger McGuire and Tim McGraw?
Spider-Man?
Tim McGraw.
No, I told you TM, and I told you if you remember that, you will know the trochlea is medial.
Okay, TM.
TM, medial. And it's going to work in the ankle too. So right now we have what did that do for me? It enables me to say that this is the medial epicondyle, and epi sits above a condyle.
Right.
If that's the medial epicondyle, and this is the trachea, which is a condyle, this has to be lateral. It has a special name. It's rounded. It's called the capitulum. But I know that above it is the lateral epicondyle. All because I remembered Tim McGraw, TM was medial. Okay, gotcha? All right. Now let's turn it over on the back. There's a big fossa on the back, and that's the olecranon fossa. The olecranon fossa, right there. What's the olecranon? It was real though, wasn't it? Okay. So, let me put that down. You just hold on to it. Can I have all the ulnas, the bones were fixed on them? There were 6 of them. They all have a hook. Yeah. I'll take the whole nose. All right. I'll take those 2. We'll be using those. Any others back there?
That's it.
All right. If you find any on the tables that look like this is an ulna.
This is not an ulna.
Yes. Yes, absolutely.
That
You
is
keep
an
that
ulna.
one.
It don't have that.
You've got one. Okay, give him one. Yes. Okay, send some back again.
It's a baby.
David, I'm charging you with getting her in with you,
Okay.
and him in with you, and Brandon Finley
Yes, ma'am.
in with you.
Sorry.
Okay? All right. All right, so now, pick this thing up. It is the only bone in the body with a hook on it.
It looks like a Lego hand.
All right, whatever it looks like, it's the only bone in the body.
Looks like a
with
Lego
hook on
hand.
it. Are we agreed? Look. See it? Look.
Oh, it does,
You
doesn't
see
it?
it? It has a hook on it. That's how you know it's the ulna. All right. On the list, we have very few things on the ulna we need to know. It has a top process, a notch, and then a lower process. The top process is the olecranon process. And now you go, oh, I'm going to be annoyed. Coronoid, coronoid. This is the coronoid process. Olecranon process, coronoid process. All right. Now watch what happens when I put it together with a humerus. But somebody's got to give me a humerus because it's wrong.
Take that one. It's already connected.
All right, I'll just all right, here we identified this, we came down here, we found the trachea, we know that's medial, we turn it over, we see there's a fossa. We call that the olecranon fossa. The olecranon process fits in it, and now you've got a hinge joint, and that's your elbow. See how neat it fits in there? It's just absolutely beautiful. And not only that, but the coronoid process came up and fits in the coronoid fossa there. And the trachea fits in the trochlear notch here. But I'm not imposing all of that on you. I'm saying you have to know the olecranon fossa and the olecranon process. And that's how they go. Isn't that neat? All right, there's one more thing on this one that we need to know. We need to find the styloid process. At the bottom, there's a point. And, hang on, I'm working on it here. I need to see your book a minute, just to verify something. Wait a minute. Okay.
Right there.
The humerus.
Yeah. I'm looking for something
The
else.
medial condyle.
Which, of course, I'm looking for it rapidly, and if I'm looking for it rapidly, I can't find it. So it's okay.
Oh, that's where the.
It's okay. It's okay.
Tib and tib.
It's okay. Oh, no. I want the radial knot.
Here it is, right there.
Okay, fine. All right, we're good. All right, we find the styloid process. You remember that I told you, use the alphabet. RST, radius on the side of the thumb. Not only that, you know from anatomic position that your thumb is lateral and your little finger is medial. So the ulna is medial, okay? And the styloid process is one of these bumps on your wrist. Well, there are two of them. You don't want the lower one, that's one of your wrist bones. You want the higher one, or the first one. And that first bump right there is the styloid process of the ulna. Right there. Uh-huh.
This one right here.
Yeah, this one. That thing. And then this is the radial notch, and this is where the head of the radius is going to rest against the ulna. And you can find that in the textbook. Now, I need as many of these as I can find. I need 3 more of these with the head on them. Okay? That's good. And that's good. I'm going to pass them out again, but no, not that one. Any more of these? That's good. All right. I wouldn't swear to it. Probably. I'd look up in here. Yes, I think it is. Probably. Plastic doesn't have all that detail. All right, now this is the radius, and how do we identify the radius? All of them have a head on them. Do you see them? And what they really look like to me is a stack of nickels. It looks like a stack of nickels stacked up right here. You see it? That is the radius. This is the head of the radius. You see? All right, well, on radius, I need head, neck, radial tuberosity, and styloid process. So pass them out. Two that way can go. He's got one. Two can go that way. And you send that one down, and send this one down, then I'll get one. All right, so on this one now, you see a bump. So you go head, neck, radial tuberosity. Head, neck, radial tuberosity. Yeah, that's easy, isn't it? All right, then you go down to the bottom and you say, oh, there's a styloid process. But I know that it's not the medial one, it's got to be the lateral one. So this thing has to go like that, which would make it, I hope it will make it a right, and you're going to have to say right or left. Some of them are easier than the others. I think this makes this a right, I know it does, a right radius. And then you feel these bumps, the higher one is the radial tuberosity, and then you get down into this spot. Okay? Exhausted. Now there's also an ulnar notch on the radius. And down here at the bottom, opposite the styloid process, is a little notch. And then the ulna would lay in that little notch. And the radius has to face the ulna, and it has to fit in the radial notch of the ulna. So the head would rest there, and the bottom would rest there. And there'd be an interosseous membrane in between. Okay? See, ulnar notch, so the ulna rests in there. The radial notch, so the head of the radius rests in there. And it goes across and go like that. And pass that over to stress. All right, if you'll grab me 2 hands maybe, or 3 hands out of the box over there. Put these on. I take that fragile scapula right in front of you. Okay, I would. Thank you very much. And place in the box over here. Thank you very much. haven't seen them sometimes, you know. Okay, that's good, you got it.
Alright. Everybody just go. Spread it. Spread it like wildfire.
Alright, so you have a couple of pans, you can have that one. I'm not making a big deal out of this, I'll keep this one. No, I'll keep, here. Here's another one.
Oh, another one. Another one.
Alright. The only thing I really need you to know are there are 8 carpal bones. These are your wrist bones, these are the carpal bones, the little short ones. Then, here on the back of your hand are the metacarpals. So that's here. And then you have the phalanges, and you have proximal and distal in the thumb, but proximal, middle, and distal in all the others. And here's the hand.
So in the thumb, you just have proximal and distal?
Yes.
Distal and proximal.
Mm-hmm. And the thumb is the pollex, but the big toe is the hallux. Hallux vulgaris, you have hammer toe or something. You know more medicine than I do if you work actively in the ER.
No, I used to 8 years ago.
Okay, well, we managed. You're a big help, believe me. All right, so I'm just going to let it go at that. That's all I'm going to ask you on the hands. All right. So we're going to put those back.
Put them back.
No, you don't have to. Now on the foot, and we haven't come down the leg bones yet. Let's do the leg bones real quick. I need as many femurs as I can get. I need 6 of them. 1, 2, here.
Alright, thank you. Hey, I know the hands. Anybody got some hands we can put up?
Oh my god.
I'm just going to hand them out again, but if you can get 2 more, it would be wonderful.
Oh, she took my finger.
All right, get them to your purse, and we can keep one.
And I learned how long ago that in the mouth.
I don't think that's too light, I think. All right, here you go, and here you go, okay? And, you've got one. All right, pick it up and find the head. Find the neck, find the greater trochanter, and the lesser trochanter. And trochanters are only present on the femur. Let me turn the page. Alright, we need to get
The legs. Right there.
not that one, not that one, not that one. Okay, fine.
Right here.
Thank you. All right, on the feet, oh, shucks. I'm sorry, I got off my list. Hold tight, hold tight, hold tight. Don't move.
I was going to say we do the field.
Hang on.
Yeah, we just got done.
Yeah, I know. All right, let's get out as many disarticulated hip bones as we can. There are 2 or 3. Right there in front of you. 1, 2, 3, 4. We have another one behind you, Rose, please. And so you keep that one. And any more over there? Anywhere? Okay. See that somebody has it there. All right, you and I have got this one. And this one is weird. I'm sure of that. It's got a little pencil. I think this one's here. This is your hip bone. You've had 2 of them. They form the pelvic girdle.
Pelvic curl.
This thing touches it. Sorry.
All right. And it is made up of 3 And so you need to name the three bones. They are the ilium, the ischium, and the pubis. Go to the next page, and it's on the next page. Ilium, ischium, and pubis. Now, how are you going to find them? You're going to hold the thing. First of all, you're going to grip up here. And you're going to say ilium. You're going to take your other hand and grip underneath, and you're going to say ischium. Then you're going to take the first hand and grip out front, and that's pubis. So look, watch. Ilium, ischium, pubis. The pubic bone is forward, so you know what is anterior. This is anterior. You also know that it is concave forward, so this is inside. But look, there's a socket, okay? See the socket? You see the socket out here. The socket has a special name. It's called the acetabulum. It's formed by all three bones. You can see the suture line, but they are fused at this point. But the acetabulum is where the head of the femur fits. Obviously, this is a big femur and this is a child's hip bone. But if we put it together right, this big, we don't have that, the big head of the femur would fit in that socket. All right, now there are other things on here that you'll want to know. Okay. One, you'll want to know what's anterior. So the pubic symphysis is anterior. This is the pubic symphysis. It's where the two pubic bones come together in the front. There is a pad of fiber cartilage that keeps you from grating every time you move. And also at the time of childbirth, that pad of fiber cartilage softens just a little bit and allows the bones to expand just a little bit. But so far we've discovered then that this is the ilium and this is anterior. And this is the ischium. So we start down our list. We have the iliac crust. Feel your hip bone right here. That's the iliac crust. Okay, on the anterior side of the ilium is the iliac fossa. Here is your iliac fossa. And then, if we look here, you have a roughened surface, and it looks a little bit like an ear, and that is called the auricular surface. And I'll take a sacrum from over there, please. Right in front of you. No, the other one. Right in front of you. That one. See how this is going to fit against the auricular surface here? And now you have your sacroiliac joint. I don't know what time it is. How many more minutes? Good?
Yeah, 44.
Okay, good. So this is the auricular surface. And it forms the sacroiliac joint. Now, I know this is front, I know this is top. Let's go. This is, in my opinion, this is a graduate school exercise. But this is anterior superior iliac spine, anterior inferior iliac spine, followed across to the back, posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch. And the notch is where the sciatic nerve goes through. Okay? Yes, it is. And then we go to the ischium. That's the bottom bone. All right. The main thing is the ischial tuberosity. The ischial tuberosity is what you sit on when you sit up straight. Okay? If you're sitting in a appropriate posture to your secretary, and you're sitting up really straight, if you rock back and forth, you're sitting on your ischial tuberosity. Okay?
you're sitting on it, I must be mounted.
Now, there's one other thing, this over up here is the ischial spine. We aren't going to pay too much attention. This is the obturator foramen, and nerves pass through here. It's also spanned by ligaments that divide it into two different components. Now, I want to point out to you the ischium only goes halfway across. So this is the ischial ramus here, and then the pubis has a superior ramus and an inferior ramus. Then we have the pubic symphysis, and across the top, the pubic crest, and a little bump for pubic tubercle. And that's all I need there. Now, if I could have one of those pelvies, preferably the female one,
This is not the
there's
This is the female one, right? This
a pelvis, okay. All right, here we go. Now, if you go to your textbook, there's a section that says pelvimetry, okay? And pelvimetry is how they measure the woman's pelvis to determine if she can carry a baby or not. I've never seen it done, I don't know anything about it, but in theory, this is what you do on an x-ray. We identified the sacral promontory right here. The top of the sacrum, it's the anterior part. And they run a line visually on an x-ray from the sacral promontory to the pubic symphysis. And then they run a line this way from the pelvic brim on either side. And this is the pelvic inlet right here. Now anything below that is true pelvis, and anything above that, up to the level of the iliac crest, is false pelvis. And I only point that out because it's in the textbook. I'm really weighing out now. All right. Good, thank you so much.
How long before you want us to let you know what the thing was? The test?
I want to finish the leg dance real quick.
Okay, I just didn't know.
I know. But I can keep you over at 5 o'clock probably.
Okay.
That's cool.
All right. So now we want to go to these big plate things. So now it's time to pick up the femur. Okay, you know that the head of the femur goes into the acetabulum. You also know that if I ask you right or left coxa, it has to be my left. Otherwise, my leg would be growing out of the inside of my body. It wouldn't work. So it has to go like this. The pubic symphysis has to go forward, the flare of the hip, and the acetabulum out. There's no mistaking this is the left, right?
Right.
And I didn't intend
Oh, so when you put it on the desk, you're gonna say, and I'm gonna say, this is left,
it. Yes.
because I'm gonna put it up on my
You
hip.
you may pick it up, just don't knock the labels off.
Okay.
All right, so the head of the femur is going to go into the acetabulum, okay? And we go right down here, we go head, neck, greater tubercle, lesser tubercle, down the back of the femur is a rather sharp line, and it's called the linea aspera. And up here at the top, it splits into a V. It's shown well in the lab book and the textbook. And that's the gluteal tuberosity, and that's enough of that. But let's go to lateral condyle, medial condyle, lateral epicondyle, and medial epicondyle. All right. So you already know you can only go into your hip this way. Therefore, this is medial, that's lateral. All right, the condyles are the lower part, so this would be medial condyle, medial epicondyle, lateral condyle, lateral epicondyle. Turn it over. There's a notch or fossa. It's between the condyles. It's the intercondylar fossa. Put your finger in it. See? And then this is the patellar surface here. There is a little bag of patellas around here somewhere, maybe over there. Okay. Pass it around, look at the patella. Yes, that's where the patella lies, right there. Right there, Okay. And the patella is a sesamoid bone, it's embedded in the tendon of the, quadriceps muscle. All right. Now let's look at the tibia and fibula and then call it quits.
Am I supposed to take these out of the bag?
Huh?
Am I supposed to take them out?
No, you can take them out, but keep them with the bag and pass it around like that. You've got one, Jackie, please, and, over here, see if we can scrounge up some more. Maybe we can scrounge up, here's another one, here's another one. And don't forget to look at the knee joint and the shoulder joint. Here, we might get it. There's not much on the list. It tells you we need a lateral condyle, a medial condyle, and intercondylar eminence. Well, let's look at the page. This, my mother would have said this looks like a piano leg. It looks like the leg that would support a spinning piano. See, it's flat on top, and then there's a bump in the middle, and that bump is the intercondylar eminence. That little bump right there. Now you want to know about this thing at the bottom. And you want to know, is it lateral or is it medial? And so this is where Tim McGraw comes handy again, okay? I mean, you can use any name you can think of with a TM, but it works on the tibia. There is a bump at the bottom. We say, okay, Tim McGraw. All right, so that has to be medial. So here is my leg, and that's it has to go medially, and that's the inner bump on my ankle. The inner bump on my ankle. And that's called, I never know, malleolus or malleolus, I think it's malleolus. And so that is the lateral malleolus, right here. Here, look, the bump on your inner ankle. Okay? Alright, so if I know that that's medial, then this has to be the medial condyle, the lateral condyle, the intercondylar eminence, the tibial tuberosity. Feel the bump right below your knee. That's the tibial tuberosity. You see it right here? Okay. The quadriceps, watch. You can show me up there, Della. The quadriceps muscle is made up of 4 muscles. And all the tendons come together, and they cross the knee joint right there, the white. And so that white is the combined tendon of the quadriceps. The patella is embedded in it. It becomes the patellar tendon, and then it inserts right there on the tibial tuberosity. Excellent. Perfect. Thank you very, very much. And then the sharp line that is your shin bone is the anterior crust. We only have the fibula yet to do, and in essence we're done. Get me a whole handful of these skinny squares. Okay, you can pass 3 of them that way. And we'll pass double of them this way. All right. Now this one just fits most of the time because it's nondescript. The tibia is the weight-bearing bone. This one is only a stabilizing bone. It does not bear the weight of the body. It stabilizes the leg. If you look at it, one end of it sort of looks like a spatula or sort of flat, and the other end of it kind of has a point on it. And sometimes they aren't even that clear, okay? So you want to find the pointy end, and if you knew that the tibia was medial, that pointy end is lateral. So that is the lateral malleolus. Okay? So you lay it on your leg like this. The lateral malleolus. And I don't think there's anything else particularly. Now, this would be the head and anterior crest, anterior crest. Don't worry about it. Just remember that if the other one was medial, this is lateral. Now, grab me some feet, 2 or 3 feet. One that way. They've got one. Okay, neat. You all have one. Let's look at this. There are only 2 bones here I really want you to know. I want you to know if in the wrist there were 8 tarsal bones, carpal bones, bad. In the ankle there are 7 tarsal bones. This one is your calcaneus. It does not make contact with the tibia. The one that makes contact with the tibia is the talus, here on top. But what this one does, and Della did such a fine job before, if you go around to the back of the guy's leg, the tendon, actually you can do it over there on those legs. See the tendon coming down the back of the leg, back of the calf, down here. Okay, excellent. Your calf muscle is the gastrocnemius, and then you see that tendon going down and attaching to the calcaneus. Okay, that's the Achilles tendon. And if that gets caught, that muscle shrivels all up because there's no tension on it, and you can't walk or run. But that's where it attaches, is right there to the calcaneus. And that's the Achilles tendon. This is the one that makes contact with the leg bone. These are the rest of the tarsal bones. These are the metatarsal bones. And then the big toe is the hallux, proximal distal phalanx. Then the 4 toes, proximal middle and distal phalanx. And I'm done. I'm going out for some sugar. I'm going to go get an ice cream sundae, a chocolate hot sundae, a lot of water. I'm dehydrated from swimming for 4 hours because you lose water in your blood. And